What can your OBGYN tell you about your fertility? When I start a basic fertility workup, I have 3 main questions that I need to answer. Are you ovulating? Does your partner have normal sperm? And are your tubes open? You have to have all 3 of those things. Your OBGYN can help look into whether or not these things are normal. The first question I try to answer is whether or not my patient is ovulating. There are a few ways to look at this, and a lot depends on the patient's history. If you have regular menstrual cycles, you have about a 90% chance that you are ovulating. But how do we get to 100%? To find out with 100% certainty if you are ovulating, there are a few things that we can do. One is you can test for ovulation at home with luteinizing hormone strips, and you can test your urine for the presence of luteinizing hormone. It's not a perfect test, but if you're using them correctly, they should be able to tell you when you have your LH surge. The other way to test is to test on the back end to see, did your ovary release an egg? The way that we do this is with a blood draw about 7 days after ovulation. What we're looking for is a progesterone level that is greater than 3. As for our other questions, sperm parameters and open tubes, those are some additional tests. So a semen analysis is an incredibly important part of every fertility workup. Hysterosalpingogram is the imaging modality of choice to look for the patency of the tubes, because what you need is dye to go into the uterus and then an x-ray to take a picture to watch if that dye spills out of the tubes. This is how your OBGYN can help answer questions about your fertility and hopefully get you on the road to conceiving.